If you live in the state of Minnesota, by now you've probably heard that UCare will be dropping all of its Medicare Advantage members. This equates to around 158,000 people in the state of Minnesota that have a UCare Medicare Advantage plan that will not be renewing for the new year. So if you currently have a UCare Medicare Advantage plan, that plan will be good till December 31st of 2025. If you have a UCare Medicare Supplement, this change does not apply to you. So what I want to do today is obviously point out this is a very significant change, but give you some ideas of what you can do given the fact that you're losing your plan, and shed a little bit of light on the Medicare Advantage market as a whole. So historically, what I would say to you is if you lose a Medicare Advantage plan by no fault of your own, okay, that's an inconvenience. You need to just find another one. Well, if you look at the news headlines, UnitedHealthcare is dropping 600,000 people across various states. Humana is dropping 500,000 people across various states. And this exact same thing happened last year during last year's annual election period. Both UnitedHealthcare and Humana did the same exact thing around the same exact membership number. Anthem, or also called Elevance, is dropping over 100,000 people as well. So the idea here that I'm trying to point out is there's significant changes in the Medicare Advantage market. Anytime one of these companies enrolls an individual, Medicare pays them a dollar amount per month. So this could vary everywhere in the country. It could be paid $1,000 a month. They could be paid $1,500 a month, just depending on the geographical location and the claims. Well, whatever that number is has not been enough. So what these companies are looking at is they're looking at their whole membership and deciding what areas of the country are we losing money on of these plans, and then they're turning around and just not renewing them. I cannot emphasize enough to you that when an entire company like UCare ends all of their Medicare Advantage plans, that is a significant problem in the industry. It's not just that's odd or that's an inconvenience. No, you have to think of 158,000 people that UCare had, and let's just say they were making millions and millions of dollars in premiums coming in from the federal government. So something must be very, very wrong for these companies to be shedding members so rapidly. So last year, this happened with Blue Cross Blue Shield of Washington State, Blue Cross of Kansas City. I forget there's a few others as well, but we're seeing this mass exodus in the industry, and I want to give you some advice of what you can do. So here's my 2 recommendations. First and foremost, check your mail. See if you received an annual notice of change or a non-renewal notice. If you have UCare, you most likely received a non-renewal notice. In past years, they send you an annual notice of change, just highlighting small changes to the plan, but basically telling you it's going to renew into the new year. You have 2 choices in coverage options. Get the letter, read it for yourself, look at the effective date of 12/31/2025, see what I'm referring to. So you could go back to the marketplace and look at UnitedHealthcare, Humana, Blue Cross, whoever's available in your county. Okay, that's the big difference. Is what we're seeing is that companies used to be pretty much everywhere in all counties. Well, now what they're doing is they're removing sections of counties and no longer offering plans. I highly, highly recommend that you consider a Medicare Supplement plan. Because you're losing your UCare plan by no fault of your own, this will create a guaranteed issue right. This means that you can now get a Medicare Supplement plan without any medical questions asked. Now, I know what you're thinking, but hear me out. you're thinking, I can't afford a Medicare supplement plan. Why do I even need to continue watching? But I want you to think through this. Minnesota, the state of Minnesota, how Medicare Advantage plans work is much different than, say, the state of Florida. The state of Florida is filled with dozens and dozens of companies offering zero premium plans. In Minnesota, depending on where you're located, you could pay $0 per month. You could pay $50 per month. You could pay $96 per month. You could pay $200 a month. Those are rough numbers that most Medicare Advantage members pay in the state of Minnesota. So whatever you have today with UCare, whatever tier plan you're on, okay, first, that plan is gone. All of the features and the benefits of the plan that you're on right now are for the calendar year of 2025. So everything you're used to is gone, unfortunately. So with what you have today, and when you're comparing a plan for 2026, let's say you do find other Medicare Advantage plans to compare to, there's a very high likelihood that your 2025 UCare benefits are going to be richer and more affordable than the next company that's going to offer you a plan in 2026. So while you're used to this, you may now be looking at this for 2026. So when you're shopping and comparing, or if you're calling us or working with us, because we're helping people through this, a lot of people are saying, I had a $1,600 debit card with UCare. So UCare basically said, if you become a member, we'll give you $1,600 in a debit card. That should be a big flag as to why they're getting out of this business. $1,600 is substantial. But my point is what you are used to is now gone, and what you're going to have available, you need to try to find the next closest thing. So whatever benefits are offered through other companies in 26 are most likely not going to be as good as your 2025. And that's the history in the health insurance market, is that year over year, unfortunately, premiums increase, copays increase, deductibles increase. They don't ever go down. Very, very seldom do they go down. So as I mentioned before, I want to encourage you to think about a Medicare supplement plan much differently than you ever have in the past. We are in a very new day and age in the Medicare landscape, and this is not just quick business as usual. There's major disruption, and with these major companies doing this, this is a big sign of the industry is going to start to shift more towards the HMO model, because right now big companies like UnitedHealthcare and Humana are not paying a commission for a PPO plan in many counties and many zip codes for 2026. They are basically discouraging sales for agents like ourselves on PPO plans and encouraging HMO plans. So that is brand new. That has never, ever happened before. So I want you to think about a Medicare supplement because you have that guarantee issue right. You have to remember that if you're in an Advantage plan with a premium, you're already paying that premium. You have certain copays and out-of-pocket limits with your Medicare Advantage plan. Probably in the vicinity of $3,000 to $4,000 a year is your out-of-pocket maximum. Well, the interesting thing and kind of exciting thing is that in the state of Minnesota, they have 3 or 4 different style plans, all ranging with different coverage levels and different premium ranges. So when you take your UCare plan and you look at the fact that it has prior authorizations, that means that UCare has to approve your care first, depending on the circumstances or the procedure beforehand. A Medicare supplement does not do that. When you walk over to Medicare supplement, you do not deal with those prior authorizations. That is a huge factor that most people don't understand. Most Advantage plans, again, depending on the type, if it's an HMO or PPO, can have those prior authorizations. A Medicare supplement plan will not. The next big factor is your out-of-pocket maximum with a Medicare Advantage plan is already at $3,000 or $4,000. So if you look at a Medicare supplement in the state of Minnesota, they do have one that has a $2,800 out-of-pocket max per year, and that is a substantially lower premium, sometimes under $100 depending on your age in the county. Again, I'm giving you generals here, and averages, not exact. So they have one plan that has an out-of-pocket limit of $2,800 that mirrors a lot of the Medicare Advantage plan out-of-pocket limits. Again, with a Medicare supplement, you do not have to pick a network. You do not have referrals. With a Medicare Advantage plan, you do. So Medicare Advantage is 12 months. Every year, it's year to year, and they can cancel you just like you're being canceled now. Medicare Supplement, as long as you pay the premium, you will not be canceled. Your benefits also will not change on a Medicare supplement. On a Medicare Advantage plan, the benefits change every year. Copays go up, out-of-pocket maximums changes, percentage changes, pharmacy benefits change. Now, if you do have a high deductible supplement in Minnesota, that deductible will most likely go up a little bit in small increments per year, but the actual coverages will not change. So again, that's a huge factor to consider there as well. Now, one of the downsides is that a Medicare supplement does not have a drug plan. Medicare Advantage does. So you will have to look at pricing, look at your total price per month on Medicare Advantage, and also look at your out-of-pocket maximum and look at how much you're spending in copays for your services, because all of that all of those copays and percentages could be applied towards a premium on a Medicare supplement plan. So this is just a high-level comparison. If you want to understand the difference in more depth based on your county, because your county is going to be very critical in determining what plan you had and then what's available, to see where the apple for apple comparison comes in. But my final recommendation to you is look at both Advantage and Supplement, but I cannot emphasize to you enough, this guarantee issue right that you've been given with UCare dropping you is substantial. If you can afford it, I cannot emphasize enough, get on a Medicare supplement if you can afford it, and don't look back, because Medicare Advantage is changing, and it's only going to start changing more, and we're moving in a direction of more HMO style plans, which means even more regulation on your health care. If you have questions or if you need help, comment below, call us direct. We would be happy to help you do a side-by-side comparison of what Medicare Advantage plans are available in 2026 in your county, along with how that stacks up to a Medicare supplement plan. But do not underestimate the value of your guarantee issue right, and do not underestimate the overall value that a Medicare supplement brings. The fact that you wouldn't have prior authorizations and complete network freedom. You can travel to see specialists. You can go to specialty facilities that maybe your Medicare Advantage plan didn't let you have access to. If you travel, Medicare Supplement is going to follow you all the way around in that as well. So thanks for watching. I hope I didn't overwhelm you. If you have questions, comment below. Give us a call. We'd be happy to help. Thanks for watching.